Good afternoon, Year 10. So, we're going to move on again with our hormone topic. Last time we talked about the menstrual cycle and puberty, and today we're moving on to talking about hormones and contraception. Now, this is as part of a 3-lesson topic, mini topic within the topic, on reproduction in general. So we're doing today how to prevent yourself getting pregnant using hormones, and not hormones actually too. And next lesson, we're going to talk about how you can get yourself pregnant using hormones. To be fair, none of you. How a woman could get herself pregnant using hormones. So today, we're going to talk about 2 different types of contraception. Hormonal contraception and non-hormonal contraception. Now, I am going to ask you to do a little bit of independent research as part of this task. I'm going to give you some paperwork to use, and hopefully that'll be effective for you. So, the first thing is to know what these hormones do. The reason being that they are going to be very useful for contraception. So, can you please tell me what those 4 hormones do? Don't feel the need to write it down. What do they do, though? Just think about it. So, hopefully, you knew that estrogen built the uterus lining up, progesterone maintains that lining, FSH causes an egg to develop, and LH causes the egg to be released. You've got to know those 4 hormones fairly much off by heart. As I say, we're going to go over that again and again for the next few lessons. What hormones would it be useful to stop if you wanted to stop someone getting pregnant? Is the thought. Because with hormonal contraceptives, you're going to be using at least one of those hormones to prevent yourself getting pregnant, and you're going to be wanting to stop at least one of those hormones. So, which ones would be useful to be able to stop? Which would be the easiest thing to stop? Well, if you think about it, stopping any of those 4 will prevent you getting pregnant. However, stopping estrogen and progesterone just stops the lining growing. It doesn't stop the egg getting fertilized. And for some people, deliberately stopping the lining growing and yet allowing the egg to get fertilized is almost akin to abortion. You're not allowing the egg to grow. And so we don't really want to stop estrogen and progesterone because some people disagree with that. And it's very easy to stop either FSH or LH, because FSH and LH cause the egg to be released. If there's never an egg released, then you physically can't get pregnant. It's not possible. So if we could 100% stop the egg being released, it would be a perfect contraceptive. And the way we could get towards doing that is by preventing FSH from being released. Now let's make it a little bit even more difficult. Which of those hormones did we say would prevent FSH being released? Well, hopefully you remember it's estrogen and progesterone. So if your body is full of estrogen and progesterone, you won't have any FSH released. So, a lot of the hormonal contraceptives we're going to talk about contain estrogen or progesterone or both in order to prevent FSH being released, in order to prevent an egg being released. And if there's no egg, there can be no pregnancy. So, that's pretty much what I've just said. And you should have got those notes down last time anyway, that we know that FSH is not released if you have estrogen and progesterone. And why might this be useful? Hopefully everybody we just talked about it would know that that's going to be because it prevents the egg being released. Now, there is a Word document attached to this assignment containing information about 4 different hormonal contraceptives. It's the pill, injection, implants, and skin patch. Now, usually we do this as a circus, that's what I've described there. All I want you to do is to skim read each piece of information and get down the key, most important 4 bullet points from each. And I mean short. Basically, what does it contain? how does it work? Maybe how is it taken and how effective is it? That kind of an idea. The key information I would need if I was trying to decide, well, do I want to use the pill or the injection or implants or skin patch? You will find a lot of them are very similar because they all work in very similar ways. Now, once you've done that, you'll be doing these questions. So this is going to take you some time, probably a good 10 minutes, I would say. To pause me, find the key information on those 4 types of contraceptive, and then do these 4 questions in full sentences. So pause me now, and then we will get this information, we will talk through it. So, hopefully you paused me there, or you won't have anything like enough time. The particular benefits of the pill over the other contraceptives. Now this will be down to individuals. But along with the injection and the patch, it does also prevent various cancers. That is not a particular benefit. So particular benefits of the pill is going to be something like being able to store large amounts of the contraceptive in small areas. With patches, you need boxes. With these things, you can literally slip it inside of a purse or anything like that. You could also talk about having it easily laid out. You can see the picture on the board, so you can see exactly when you should be taking each pill. That kind of an idea. It's more ease than anything else, because the patch and the injection, they have similar effects. The main disadvantage of the implant is that it is semi-permanent, and you have to have it taken out by a doctor if you want to have a child. Now, there's the other disadvantage that has to be put in by a doctor. Now, I don't know about you, but if I had a choice between a contraceptive which I could take as a pill myself without ever really having to speak to anybody about it, you get it from a pharmacist and you just take it, or actually having to go to a doctor and have something inserted inside my body, I would probably, just on the face of it, prefer to take the pill. So that's the main disadvantage of it. It's more invasive. How long does the injection last? We're talking something around 12 weeks. What hormone is placed in the pill? Now this is almost a trick question. The combined pill, which is what you were learning about, is estrogen and progesterone. You can also get progesterone-only pills or estrogen-only pills. Some women are almost allergic to one or the other, and they do have subtly different effects on different women. Fine. You should know those fairly much off by heart. Now I have to say, the questions you'll be asked about this, and I'll show you one later, they usually do give you the information anyway and then ask you to evaluate it a bit like I have there. But you do technically need to know the advantages and disadvantages already. Fine. Let's move on. Non-hormonal contraceptives. Now there are 4 which you're supposed to know about. I'd like you to have a go at writing as many of you as you can think of. There's an example on the board. What can you think of? Underneath the subtitle, non-hormonal contraceptive. Fine. So, list you should have come up with something along the lines of condoms you should definitely have talked about. You also talked about diaphragms, which we're going to talk about in just a second. You talked about surgery, for instance, a tubal ligation or a vasectomy. You could talk about, well, let's move on to going through the list individually rather than going through the whole list right now. Now, the 4 you need to know about are barrier methods, which we'll talk about individually, IUDs, which we've already touched on in the hormonal contraceptives section, so don't feel the need to talk about that right now, surgery, and then abstinence. Fine. Now, barrier methods include condoms and diaphragms. Now, either they're going to fit over the penis or inside of the vagina to prevent sperm entry. Positives and negatives, what can you think of? So, the kind of thing you need to know, and incidentally, you should have paused me at some point and get down that list of things about it. I think we all know how a condom works, but I still think it's good to have complete notes, particularly on diaphragms. You might not remember what a diaphragm is. In any case, positives. This is only for condoms and not diaphragms. No STIs. Now, this specifically condoms, which is by far the most common type of barrier method, but no STIs. This is the only type of contraceptive that will prevent you getting an infection. And yes, to be fair, for anybody who doesn't know, sexually transmitted infection, often also called an STD, sexually transmitted disease, Condoms are the only type of contraceptive that will prevent you getting, for instance, gonorrhea, syphilis, HIV, anything you can think of. And if used correctly, should be 0% chance of pregnancy. Now let's be careful here. This is if used correctly. Nothing is ever used correctly, and in actual fact you're looking something around 96 to 97% mark in reality on its own, because the moment that a man starts thinking about sex, and it's likely to happen anytime soon, his body starts producing small amounts of what we call pre-ejaculate. Now, pre-ejaculate contains small amounts of sperm. So even long before the man actually has sex with a woman, if it is likely to happen in the near future, his body starts producing small amounts of pre-ejaculate. Basically, that coats the outside of the penis in sperm. It also makes it slightly lubricated to make sex easier. That means that, and I'm not going to go into horrible details for you, but even the act of taking your trousers and underwear off, as if you even brush your hand over your penis, you will have very small amounts of pre-ejaculate on your hands. And you can definitely imagine how that pre-ejaculate could get onto the outside of a condom, how it could get onto the inside of your clothes. It can get around. And it includes taking the condom on and off and putting it on correctly. So there's all kinds of things that can go wrong. And condoms on their own are not actually a particularly effective type of contraception. Though they are about 96% effective, you compare that to above 99% for the pill. Really, if you want to make it very unlikely that somebody will get pregnant, it's important to use more than one type of contraception. IUDs we just talked about, I'm not going to go over them again. Broadly, it's supposed to kill the sperm, and that contains a small piece of copper. Copper kills sperm. Rock kills scissors, scissors kill paper, and copper kills sperm. Okay, so that's nice and easy. Positives, very, very long term. If you are somebody who definitely knows they don't want to have a baby anytime soon, you're not in a long-term relationship, then if you do not want to be pregnant, you can wear an IUD. Wear, that's the wrong word, it's inside your uterus, but you can have an IUD. And it's extremely effective, around 99%, much more effective than a condom really is. Negatives, okay, it doesn't prevent STIs, so you still have to wear a condom. And secondly, must be removed by a doctor and must be implanted by a doctor, which, as we talked about earlier, can be very uncomfortable for people. Now, there's no reason for it to be uncomfortable. Doctors do these things all the time. They're not embarrassed about it, but still, it's quite natural. People do feel uncomfortable about it, and so they don't want to do it. And so something like a condom is considered easier. Fine. Surgery. We're getting towards the extreme end of contraception now. This is for people who know, I never ever want to have a baby ever again. Let's say I've already got a large family. I know, no more babies for me, thank you. And actually, doctors will talk to you before you have this surgery about have you actually made sure you've thought about this decision properly. Because what we're talking about here is deliberately chop the sperm duct to prevent sperm leaving the testes and getting to the penis. Or effectively tying up, that's a little bit more complicated than that, the fallopian tubes. This is called tubal oclusion or tubal ligation, and basically, often colloquially called having your tubes tied. We're talking about preventing eggs getting to the uterus. And eventually that egg will die, as eggs do. Now this should be 100% effective. Now every now and then you see a news story where a man has a vasectomy and then has kids afterwards. That's almost certainly down to botched surgery, but they should be 100% effective, and the fact that it ends up in the news, the local news, when it happens, shows how unlikely it is. It should be lifelong, so that if you know you never ever want to have a child again, you don't ever have to think about contraception again. Downsides, of course. A, it's worth noting it doesn't prevent STIs. You can still spread infections even though you've had this happen, because the infections are not coming from the sperm, they're coming from the fluid which surrounds the sperm, and that still comes out the penis. And the infections are also not coming from the egg, it's coming from the fluids that are inside the vagina, and that is still released after this. So STIs are still possible. And it should be irreparable, okay? Unless you decide literally immediately, and you're very fortunate, it should be irreparable. Fine. Positives and negatives. You pause that there if you haven't got them down. I know there's a lot of writing today incidentally, I apologise for that. It's just a lot of facts we need to know. The final one, and the only one that is absolutely 100% effective, and it's on the GCSE because of that reason, abstinence. Now, abstinence is choosing not to have sex. Now, sole abstinence, pure abstinence, is 100% effective, guaranteed to prevent pregnancy. So we can move on from all of those kind of teenage stories of, I don't know, sperm surviving in the bath and then a lady having a bath or in a hot tub. It is impossible to get pregnant unless you have sex. So if you do not have sex, you cannot get pregnant. It is the ultimate contraceptive. Now, the other kind of abstinence they want you to know about for your GCSE is abstaining during the parts of the menstrual cycle when the egg is likely to be released. This is called the rhythm method. Now, the rhythm method is absolutely the least effective type of contraception we'll talk about. It's used by people who disagree with contraception as an ethical issue. They think that contraception is wrong. So some religious groups believe that contraception is wrong, and obviously that's fine, that's their decision. But then the only type of contraception they can do is the rhythm method, which is to have sex with their wives or husbands, but only on those, they usually say about 6 or 7 days, when it is unlikely that there is an egg in the fallopian tube which is alive. So we're talking about the 6 or 7 days before the woman has her period. Now, on average, this is apparently 76% effective, which means that if 100 women use this method for a year, by the end of the year, 24 of them will be pregnant, roughly 1 in 4 of them. That means if you do it for 4 years, you will likely have a baby by the end. Okay, so it is extremely unreliable. But it is a type of contraception. Now, again, abstinence of that kind does not prevent STIs. Abstinence, where it's complete abstinence, 100%, is STI-free, assuming that you're not doing other forms of sex, for instance, oral sex. So, positive negatives, we're looking at 100% guaranteed. Negatives, you don't have sex. So that is the only type of contraception which completely stops you having sex. And that is for the rhythm method and abstinence, because of course with the rhythm method, if a couple want to have sex during one of the other 24 days of the month, they cannot. So that is the negative. Fine. Now, with all of these contraceptives, minus complete abstinence, of course, it's worth bearing in mind that there is always a chance of a person getting pregnant. So it's important to be extraordinarily careful in the contraceptives you use and how many you use and the way you use them. Hopefully, by the end of this lesson, you're feeling like you've understood some of that. Now we're going to talk about some questions on this. And these are exam questions. So we're moving on from general life advice to actually getting some grades in your exams. Now, we've got 1A here. Explain one way in which a hormone can prevent conception, pregnancy. So pause me. What would you think the answer would be for this question? Right, let me skip you on to the answer then. So we're looking at inhibit FSH production so egg does not mature. Fine. So there's 2 marks there, and this is the only way we use hormones to prevent conception is by inhibiting FSH production. Fine. Good. We come up to part B, which is a lot longer, and this is a 4 marker. So there's some information there, and I said to you earlier, this is the kind of question you're going to see, where they give you some information about a hormone, and then about a type of contraception, and then they ask you to use that information or to evaluate that information. So give that a read. There's a lot of writing there, but the actual question is 4 marks. It's an evaluate question, which means positives, negatives, your opinion. Fine. Pause me, 4 minutes, off you go. Fine. They very helpfully here said at the bottom, remember to give a conclusion to your evaluation. They often don't say that. You still need to do it. For any evaluation, you should give your opinion. Even if your opinion seems completely irrelevant, just write down a opinion that you've decided on and why. So the question is, which one's better, basically? And the answers we can have are any 3 comparisons. So for instance, and you can read these yourself, but I'll very quickly fly through them. Insertion compared, i.e. the ring is easily inserted, whereas the implant needs a professional. So we're talking about it being easier to get the ring in. Length of delivery, so 3 weeks for the ring, but 3 years for the implant, or the delivery is longer for the implant. Or a different idea that the woman has to remember to insert the ring, whereas she does not have to remember to insert the implant. Going to compare the effectiveness, that the ring has 0.3%, whereas it's nil for the implant. Worth noting, it's never nil, it's theoretically nil. Number giving up compared, e.g. 4% for ring, whereas 2% for implant. So few people give up using the implant because it's quite difficult to give up, you have to have it removed. Or the ring might cause vaginal discomfort, where the implant may cause irregular menstrual bleeding. And then a reasoned conclusion for 1 mark at the end. That means you have to give a conclusion. I think that the ring is better. And your reason. Because of what I said about it being easier to put in. If you don't give a reason, you don't get a mark. So be harsh with yourself. Did you actually put a reasoned conclusion? It's the main way people lose marks in evaluated questions. Fine. That's the question, that's the end. From today, you need to know about 4 types of hormonal contraception and 3 types of non-hormonal contraception. There's 7 in total. Positives, negatives, how they work. That's a lot of information. If you could answer that question at the end, though, you're probably going to be fine, because the vast majority of these questions are about giving you the information and asking you to use it. But for your life, it's also relatively important that you understand at least the bare basics of each type of contraception, because at some point in your life you are likely to need to choose one. Hopefully that's been useful for you, and I look forward to seeing you whenever I'm able. Have a great day.